Counseling for Tobacco Cessation, Part 1, Overview and Approach to Counseling. Our learning objectives are that you'll be able to describe the effectiveness and use of counseling in treatment of tobacco smoking. Explain the definition of motivational interviewing, which I'll describe as an approach to counseling. Describe the spirit of motivational interviewing, its 4 processes, its core communication skills, outline the elicit, provide elicit framework, and describe the evidence for motivational interviewing. So counseling has a lot of evidence. In a meta-analysis and systematic reviews of clinical trials, they've found that a combination of behavioral counseling and pharmacotherapy produce the best results for smoking cessation. So while medications are the single most effective treatment, combining it with counseling has even greater efficacy. In the United States, insurance plans are required to cover tobacco cessation interventions, including behavioral counseling and medications approved by the FDA. However, approximately 80% of smokers do not receive physician counseling to quit during an office visit. I'll describe both an approach to counseling and the content of the counseling session. The approach to the counseling will be covered in this part, and the content of counseling will be covered in part 2. Motivational interviewing is an approach to counseling rather than the content of what's actually covered in the interview. We'll cover the definition of motivational interviewing, what's called the spirit of motivational interviewing, the 4 processes of motivational interviewing, core communication skills, and the elicit, provide, elicit framework. And I do point you to our training in motivational interviewing, which is also online and involves practice and training to proficiency in this skill. The definition of motivational interviewing. Motivational interviewing is a method that works on facilitating and engaging intrinsic motivation within the client in order to change behavior. It's goal-oriented, client-centered counseling for eliciting behavior change by helping clients to explore and resolve ambivalence. There are 4 components to the spirit of motivational interviewing. We'll start with collaboration. So when the counselor talks to a patient who smokes, the philosophy is that the counselor has some expertise. They have knowledge of tobacco cessation interventions that work. They have experience with other smokers who have quit. But just as much as the counselor is an expert, the patient is an expert too. The patient knows better than anyone else, better than anything you could look up, what would motivate them, what their reasons would be to quit smoking. And the patient knows better than anybody else what would work to effectively stop smoking. So in the spirit of motivational interviewing is this collaboration between experts. Acceptance is, rather than going into the conversation where the clinician feels like, I have got to change this person, and I have got to get them to see what's wrong, and I have to change them. It's essentially accepting them for who they are. Not approving of their behavior, but accepting that if they are going to change, it's completely up to them. And it's not, nobody can force their change. And acknowledging their strengths and affirming their best efforts. And the irony is that when people feel accepted, they feel possible of change. When people feel like they're condemned or they're not accepted, then they feel incapacitated, unable to change. Evocation is, and this is probably the most important thing to consider when we cover content later, rather than loading up on information and having this incredible pitch that you make to every patient on why they should quit smoking and how they should do it. The evocation component of the spirit of motivational interviewing is that you're actually going to bring out, you're going to evoke what already exists in the person. Not provide them with the best reasons to quit, but find out what their best reasons for quitting are. Not provide them with the best way to quit smoking, but understand what they think would work best and what they see as their challenges. And that's a big challenge in healthcare when we get loaded up with all of the knowledge and all of the evidence for what people should do, not going in there and pushing it on them, but rather bringing it out from them. It's a strength-based model that draws on the person's own capabilities rather than a deficit model that seeks to see what's wrong and install what's missing. And then finally, compassion, the idea that motivational interviewing is not done for anyone else but for the best interests of the person you're working with. And that can perhaps be important in a clinical situation where there's a lot of pressure to apply smoking cessation interventions, and the focus on the person can be obscured, and you could push to getting someone to quit without actually putting them first. There are 4 processes in motivational interviewing, and they essentially describe the flow of the relationship between counselor and patient. Engaging is basically the person is asking, do I want to work with this clinician? And engaging is fostered by listening, asking open-ended questions, reflecting, saying back to a person what you think they feel, letting them have control of the agenda. Focusing is the process where you decide where are we going to head. So what's going to be important for us to focus on. And in smoking cessation counseling interventions, the focus is pretty clear. In other settings where you're working to help someone change, whether it's multiple possibilities, focusing allows you to have an eagle-eye view of what possibilities exist and where the person thinks there would be the most benefit of focusing at the moment. Evoking involves bringing out from the person their importance and their confidence. So what are their reasons for quitting smoking? And what makes them confident that if they do decide to quit, they would be successful? So importance often goes back to values, what the person values. And confidence often goes back to strengths and abilities. Planning is the final process, and it is determined by whether or not the person thinks they want to make the change. And the plan is generated by the person's own ideas about what they think would be successful. And we'll cover planning more specifically in part 2. There are core skills in motivational interviewing, and they're remembered by the acronym OARS, Open Questions, Affirmations, Reflections, and Summaries. Open questions are questions that leave the field open, wide open for a response. Rather than, do you want to quit smoking? They would be, what would be your 3 best reasons for wanting to quit smoking? So you don't prescribe the answers when you ask the question, and the person is able to think and give an answer that allows them to explore the subject. Affirmations are acknowledging the person's prior efforts, strengths that you notice about them. They're genuine and they're specific. Reflections are a way of responding after a question. After you ask a question, you give at least 2 reflections. And what this is basically stating back to the person what you think they mean in the form of a statement as opposed to another question. So I really don't like to smoke because I want to set a good model for my grandchildren. And then you reflect, your grandchildren really mean a lot to you. Rather than asking, how many grandchildren do you have? you're reflecting at what the person means behind their words, that they really care about their grandchildren. So reflections, especially in the beginning of the conversation, reflect the emotion that the person has, and they allow the person to keep talking. It doesn't feel like two people talking, one person interviewing another. It feels like one person's a stream of consciousness. And towards the evoking process, reflections become more strategic, where you're picking out the person's statements that suggest they want to change and that they have the confidence to do it, and you're giving them back those statements preferentially. And then finally, summaries collect the person's statements and give them back to the person. They're often a collection of the things the person has said that are in favor of the change, and they are often used to transition from one process to another. So you might describe the person might describe their importance and confidence for quitting. You might give them a summary. It's really important for you to quit. You hate how much it costs, and you want to be alive for your grandchildren. You're pretty confident you'll be able to do it because you were able to quit drinking. And what do you think you might do? So there I gave them a summary, and I transitioned from evoking to planning. Motivational interviewing has a basic framework for exchanging information. Even before you begin the conversation about smoking, you can ask permission. Would it be okay if we talk about your smoking? And then when you have any information to give, and this particularly happens during the planning process, where you have knowledge of pharmacotherapy and different triggers, knowledge of cognitive-based approaches, and stress management, you'll have a lot of information you could perhaps impart. And you want to follow this framework so that it's well received. So the elicit is the first thing you do on the left. You basically find out, what do you already know about ways to help you quit? And would you like me to, or would it be okay to, if I were to describe to you some information about nicotine gum? So you find out what they already know, and then you ask permission to give a little bit of information. Provide is you can acknowledge, first of all, that, wow, you really know a lot about this. And when you give information, you're giving it in a very small bit, and you're acknowledging the person's right to choose. So maybe this doesn't apply to you, or you probably have a better idea about this than I do, but it's acknowledging that the person doesn't have to take the advice. And then elicit again is to say, well, what do you think of what I just said? You're finding out what the person already knows, asking permission to give a little information, giving a very little, small bit of information that's relevant to what the person already knows and doesn't know, and then checking back in and asking what they think of the information given. The efficacy of motivational interviewing. There was a meta-analysis in 2015 of 28 studies that compared motivational interviewing with brief advice or usual care for smoking cessation, and found that motivational interviewing yielded an increase in quitting, a relative risk of 1.26, which is a 26% increase compared to brief advice or usual care, and that result was significant. They found in particular that motivational interviewing was effective when delivered by primary care physicians or psychologists, though nurses and allied health professionals, it was also found to be statistically significant. And when these sessions were conducted in fewer number and for a shorter duration.